Hello. Today I will talk a little bit about a medication that I've used for fatigue. As you know, chronic fatigue is a major problem with a lot of autoimmune diseases. So I've seen patients with rheumatoid arthritis, for lupus, and fibromyalgia that come to me with concerns about chronic fatigue. Even if they try to exercise or sleep well, they continue to have this chronic issue of not feeling refreshed and have chronic fatigue. So this can be diagnosed after we have ruled out some hormonal problems like hypothyroidism or problems in your metabolic diseases like diabetes and anemia. So after the workup is completed, I usually talk about improving the diet, nutrition, and adding some exercise. But one medication that I've used is called Modafinil. It is a FDA-approved medication for excessive daytime sleepiness, which is seen in diseases like narcolepsy and obstructive sleep apnea. But I also think that it has great benefit when we can use it for patients who have chronic fatigue associated with autoimmunity and lupus and rheumatoid arthritis patient or patient with chronic fatigue syndrome. It has to um, it has to be used carefully because it's a controlled substance, so selection of patient is important. But it helps improve increased wakefulness. Modafinil helps individuals to stay awake, alert, and it also helps people who have difficulty concentrating. So it decreases the daytime sleepiness due to narcolepsy or other sleep disorders. Another thing to make sure for those patients that have chronic fatigue is to rule out obstructive sleep apnea, which I will talk about some other time. It also is associated with increased cognitive function. So modafinil has been reported to improve mental function, which can be a problem in people who have either chronic fatigue and they're having sleepiness, and it decreases their productivity. And improved cognitive function is important for people to be able to be productive. It improves attention, memory, and executive function. For patients who also have some problem with mood disorders, their mood does improve also with modafinil, which can be helpful in people who have excessive fatigue related depression and mood disturbances. So there are some potential risks and benefits that your physician will talk to you about, like having insomnia, difficulty sleeping because you're wired up. It can be a problem. Headaches, nervousness, and GI issues can be a problem. Heart rate and blood pressure monitoring is required. And if you have a personality that you can get dependent on medication, this can be an issue.